A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. In the name of Allah, God, the entirely merciful, the especially merciful. Welcome to our presentation at the 12th Annual Muslim Mental Conference entitled Online Photovoice to Explore and Advocate for Muslim Biopsychosocial Spiritual Wellbeing and Issues, Ecological System Theory and Allied Development. My name is Ahmet Tanhan, and if you have any questions, you can email me through my email or my Huva app account or other ResearchGate accounts or social media. And you can see my other colleagues who we have prepared presentation together. And I think you can hear my voice. I feel very, I feel kind of a little anxiety, but also a kind of happiness to have this virtual conference. So Alhamdulillah. So first, appreciating being in the moment, especially considering this COVID-19 difficult process and our life. And I also want to take a moment to appreciate our partners working very mindfully and contextually to making available this conference for us. If we were together, I would have taken some time to practice some quiet or prayer or mindfulness or silent time. But since we are not together, I would love each of us taking some quiet time or prayer time afterward. If you want to get the full manuscript for this study, please get in touch with me, or you can use these links to get the manuscript. It was published in Current Psychology in April, so it was not published when we sent this proposal. So background, how we started this presentation. Muslims in the southeast of United States, or general in the South, or overall in the United States, have many biopsychosocial economical issues, but especially we had a very important study for the Muslims in the southeast. And we identified 33 biopsychosocial, spiritual, and economic issues. So we had a really good tie with Muslim community around that area, and we kept collaborating with them. In this research, some of the most important issues and strengths were addressed, but some of them were not addressed. And key ones provided, we were able to provide some key contextual solutions after that 2019 study. However, some of the key issues were not being understood by the non-Muslims. For example, what does that mean to having water in the restroom? What does that mean to have a separate place for prayer? Why you cannot just kneel and pray? And what does that mean, halal? So we realized that we need, following our study, a qualitative study rather than a quantitative study. Also, a comprehensive literature review showed us such a study is needed. So we focus on this, that shows that study was really needed. Gaps in research, few studies about Muslims in the South, as we have said, lack of mental health professionals acting with and for the Muslim community. That means many research are being done, but there is no advocacy, there is no follow-up, and especially there is no contextual change acting with and for the Muslim community. Public and mental health professionals are more likely to work with relatively diverse group of Muslims. We had around diverse students from 100 countries for this study. And lack of research on Muslim biopsychosocial, spiritual, and economic aspects through Photovoice. And in that study, we called for the future researchers to use Photovoice to address Muslim issues and also strength, not just one, but both of them. And also in the overall literature, not just Muslim mental health, but there was a lack of online interpretative phenomenological analysis. So statement of problem, based on all these, there was a need for a theoretically well-grounded empirical research to first develop and use a contextually appropriate online photo voice. From now on, we are going to call it OPV, develop and use online interpretative phenomenological analysis, from now we are gonna call OIPA, utilize OPV to collaborate with the college-affiliated Muslims and possible allies in southeastern US to understand the most important facilitators, strengths, and various concerns affecting Muslims on their campus. So what is OPV? Before diving into the research steps, I just want to take a step and say what is OPV. In 1997, Dr. Wang and Boris developed Photovoice to work with small groups consisting of 8 to 13 people. And in 2015, we developed OPV with my professor at that time for my Ph.D., Dr. Robert Struck. He's an expert of Photovoice. And through OPV researchers, through OPV researchers can work with more and diverse participants, much easier, anonymous, and effective. So it provides many advantages compared to traditional Photovoice. OPV becomes much more practical and critical when it is difficult to meet face-to-face in the face of pandemic, endemic conflicts, wars, or natural disasters, and being contextually mindful. Right now we are in the midst of COVID-19. OPV protects the participant's voice in a much more robust way through OIPA. In Photovoice, traditional Photovoice, they use just IPA, but for online Photovoice, we developed OIPA. Our first OPV study was published in Current Psychology, as you can see, and recently I have conducted a study with OPV in United States during COVID-19. Soon it is going to be published. If you are interested and want to get the preprint, I can share that as well. So purpose of our study, we aim to develop OPV, we aim to develop OIPA and use both of these together. Enhance Muslim biopsychosocial, spiritual, and economic strengths, address biopsychosocial, spiritual, and economic concerns. So not just psychopathology, but also focusing on positive psychology aspects. Do all this through social advocacy, not just doing the research and staying in our clinics or in our ivory towers. So our theoretical framework for the study was utilizing OPV in the context of ecological systems theory and allied development with online interpretative phenomenological analysis to address biopsychosocial, spiritual, and economic issues, and also understanding the strengths. Our method, we had qualitative methodology, we had OPV as our technique. Some people would call OPV as a method. So I'm gonna use these two words interchangeably. We had 131 Muslims participants affiliated with colleges in the Southeast, 118 truly completed. So you can see the details. I'm not gonna go through all these details for the participants. Procedure, we conducted a comprehensive Photovoice literature review. I really mean that because to develop OPV and develop OIPA, you have to do that. Developed OPV based on traditional Photovoice. We developed OIPA, and we constantly attended Muslim communities meetings and gatherings and doing natural observation based on previous research, discuss what and how to move forward with the new research based on the last one. We received IRB after all of these for a new OPV study. We identified our allies, partners, MSA departments, community leaders, and partners, non-Muslims as allies to move forward. We tailored the questions with the allies partners for the final version. We, throughout the study, we were collaborating with our partners. We used Qualtrics cover letter, survey question form, OPV participation steps, and online OPV training video and audio documents, and also face-to-face OPV training. We use all of these to introduce the study and also train people about OPV, what does that OPV mean, and how to use OPV to address strengths and issues. So OPV participation steps, facilitator, So first, when the person is participating for the research, they are going through 5 steps to address what is the most important facilitator for their experience on campus. At first step, they identify the most important support strengths. You can imagine 100, you can take time to reflect on 100 strengths or facilitators, but you are supposed to come with one. Which one is the most important one? In step 2, you are taking photos of that facilitator and you are choosing that one to be uploaded to the system or to the Qualtrics or the SurveyMonkey, whatever you are using. Step 3, in step 3, you are writing a caption or a story following short acronym. I'm gonna explain those. In step 4, you are identifying a theme or a metaphor considering the most important facilitator strength, your photo and your caption. And step 5, if you are willing to come out and stand by the photos and the captions, the themes at the exhibition and community dinner, you were able to do that as the participants or allies. So after the facilitator, you are going through the same steps for the barrier, for the concern, as we have said, psychopathology and positive psychology. So the same steps, I'm not gonna go through them because I have just about 5 minutes. In step 3, you are writing a caption following SHOP. So the participant is recommended to follow SHOP acronym to make the captions and stories of the most important facilitator and barrier more effective, meaningful, powerful, and comprehensive as a whole rather than writing separate sentences for each letter. So S stands for what do you see in the picture as representative of a strength support for you as part of your life experience on your campus. H stands for what's happened in the picture you have taken. O stands for how does that relate to your life as a person and a community. W stands what is the that contributes to or creates that strength. E stands for what did you experience while taking the photo and writing the caption. And D, the most important thing to move forward with the research is what can we as whole mental health professionals, peers, university, and all do about that. So that is the point. And then the participant also use SHOP to write their caption for the concern part as well. So the results, the researchers and volunteer allies analyze the responses by following OIPA. So you are analyzing the results with your partners, with your allies. And OIPA, in OIPA, you are using 4 steps to analyze the data. The first step is checking photos and captions for missing information. The second, checking photos, captions, and themes or metaphors for confidentiality. Step 3, classifying themes of support strength under the larger umbrella of themes. And step 4, classifying the themes of concern barrier captions to come with the larger themes. You can see the results in support facilitator teams. We had 8 main teams. As you can see, supportive community, you can see the number and the percentage as well. Almost 50% of the participants said supportive community was the most important facilitator for them. Second, prayer in Islam, Muslim Student Association, then healthy food in Muslim community, the 5th, supportive campus environment, and then you can read the rest. Concern teams, 9 concern teams emerged. The first one was almost 50%, again, 48%. Lack of prayer facilities was the most important issue for the participants. And the second was lack of adequate support from Muslim and non-Muslim communities. So these are the kind of results from the Qualtrics. And you can see here captions, an example from facilitator strengths. You can see the photo, their caption is more conscious activities, and then you can see their story. And then the second one is the facilitator is having a separate restroom on campus, and then you can see the story as well. I have almost 2 minutes, so I'm gonna be very quick really. Here you can see two representatives from concern. The first is ignorance, and the second was lack of resources and places on campus. If you are interested, you can get the full manuscript. And also you get the data from the community dinner and exhibit if we are in a normal context, you know, not COVID-19. So alhamdulillah, we did not have any issues with coming together. We organized a very good dinner, and 110 people attended for 3 hours. The departments, the professors, the mayors, the police officers, and it was really the Muslim community leaders, non-Muslim community leaders. Implications, we have main implications in 4 areas: mental health services, research, education, and advocacy. I have less than a minute. I'm going to move forward. Conclusion, OPV was very effective, OIPA was very effective, facilitator teams emerged, community and concerned teams emerged, and we can move forward with the implications. And also, just within a minute, I can share the preliminary results of our recent COVID-19. You can see here, we had conducted a research in Turkey with college students, 127 attended. And last slide is, you can see also the 19 main facilitator teams emerged, and then also 21 main barrier teams emerged in our recent COVID-19 OPV study. I do appreciate all the support from all these people, and especially from Muslim Mental Health Conference. And this is all. Thank you so much. And I'm looking forward to collaborate for the need research, because I got an IRB to look at how people doing during COVID-19. So if you are interested, please get in touch with me, because I have permission and IRB to do a research globally. Thank you so much.
Thank you so much, Professor Ahmet Tanhan. I just wanted to say, I hope I'm pronouncing your name correctly. Is that right, Tanhan?
Yeah, it's totally fine. And you can go with Ahmet as well.
Okay, no, I want to make sure I pronounce it correctly. This is the least we can do. And I also want to just apologize. I'm actually calling in from Michigan, where we had a very bad rainstorm, unfortunately, in the last 24 hours. So my electricity has been cut, so I had to quickly come and find a place where I could find electricity, which is why there's been a little bit of disruption to this panel, and I came a few minutes late, and so there was also, so I just want to apologize and to say that we were not able to properly introduce Professor Tanhan, who is an assistant professor.
That's totally fine.
Yeah,
thank you so much, Beth. I'm glad you were making, you were able to make it, and you are here.
No, thank you. Thank you so much.
Your moderation.
Yes. Yeah, thank you so much. So he's a professor of Department of Counseling at UNC Greensboro, and also at Adıyaman University in Turkey. And so this is a really fascinating paper, and we'll be happy to discuss it. And so I think what we're going to do is try to save our discussion for the very end and the questions, which of course the paper provoked many questions, and I think also the possibility of how to conduct similar research in Turkey is also really provocative and interesting. So now let's move to Yasmeen Khayr's presentation. She has a master's degree, and she's affiliated with the Center for Urban Research and Learning. Farah Misbah will be, I think, setting that up for us to view together now. And also, I'm sorry, I don't think I introduced myself. My name is Zareena. I'm a professor of American Culture and Religious Studies at Yale University. So I think we'll now see Yasmeen Khayr, and she's at Loyola University in Chicago.
Assalamualaikum. My name is Yasmeen Khayr. I'm a research coordinator at the Center for Urban Research and Learning at Loyola University Chicago. The work I will be presenting on is from my master's thesis focusing on gender and sexuality beliefs among Muslim men on college campuses, with a particular focus on sexual assault beliefs. So research on sexual assault has primarily focused on women and survivors, and also on men and perpetrators. So men in general are highly underrepresented in the literature, and Muslim men even less so due to heightened stigma around sex, sexuality, and sexual violence. Muslim men are interesting because they occupy an intersection of identities that place them as both part of a dominant gender identity and a religious minority within the United States. So what this means is that while they may face marginalization and discrimination due to their Muslim identity, they also have a tendency to elevate their sense of male dominance through heteronormative gender roles. So with this in mind, I wanted to dig deeper into sexual assault attitudes and ask, what attitudes do Muslim men on college campuses hold regarding sexual assault, and how does their religiosity and adherence to masculine role norms impact those attitudes? So before delving into this research, I do want to note that this site does not mean to reify Islamophobic notions that Muslim men are inherently violent, but rather to locate Muslim men within a larger gendered structure that perpetuates violence. And just to set this up a bit further, the study came out of research done between the Center for Urban Research and Learning and Heart Women and Girls, which is a national organization focused on sexual health, education, and sexual violence prevention among Muslim communities. So together we conducted research and evaluation focused on their Sexual Violence 101 workshops, and found that Muslim men had statistically significant differences in their perceptions of sexual assault myths as compared to women and non-Muslims. And so this alerted us to dig deeper into the intersection of gender and religion as it pertains to how Muslim men are socialized to think about power, sexuality, and sexual assault. So to understand how sexual assault attitudes are formed, we must understand how it is deeply rooted through rape myths or generalized cultural beliefs that perpetuate aggressive behaviors and victim blaming to undermine the gravity of sexual assault. So many studies have associated these behaviors and perceptions with sex and gender role stereotyping that are rooted in patriarchal notions of masculinity. And so we place sexual assault beliefs within the larger context of hegemonic masculinity, in which it perpetuates and naturalizes a gender hierarchy within a social structure and through social action. So this is often through fostering sexual aggression and hostility towards women. And while there has been less research regarding the role of religion for Muslims impacted by sexual assault, we have to look at how our faith is being taught to us and how that impacts how we understand sexual assault. And so while Islam as a faith tradition frames sex and sexuality as forms of worship and service to God, patriarchal interpretations of sex has been dominated by men and have historically institutionalized sex as impure and as an act that must be suppressed. So these interpretations operate as religious justifications for shame, and they reinforce a gender hierarchy in which men are morally regulating the purity and sexuality of women as a form of power.
To understand how sexual assault attitudes are formed, we must understand how it's deeply rooted through rape myths or generalized cultural beliefs that perpetuate aggressive behaviors and victim blaming to undermine the gravity of sexual assault. So many studies have associated those behaviors and perceptions with sex and gender role stereotyping that are rooted in patriarchal notions of masculinity. And so we place sexual assault beliefs within the larger context of hegemonic masculinity, in which it perpetuates and naturalizes a gender hierarchy within a social structure and through social action. So it's often fostering sexual aggression and hostility towards women. And while there has been less research regarding the role of religion for Muslims impacted by sexual assault, we have to look at how our faith is being taught to us. And while Islam as a faith tradition frames sex and sexuality as forms of worship and service to God, patriarchal interpretations of sex within Islam has often been dominated by men. So it's historically institutionalized sex as impure and an act that must be suppressed. So these interpretations operate as religious justifications for shame, and they reinforce a gender hierarchy in which men are morally regulating the purity and sexuality of women as a form of power and control. So sexual assault attitudes are perpetuated by patriarchal power and control through the manifestation of gender and religion. So through this theoretical framework and the exploratory nature of the research, I committed to using quantitative methods through an online survey to understand a breadth of information surrounding Muslim men and their beliefs around sexual assault, masculinity, and religion. So I acquired 47 participants who fully completed the survey through convenience and non-probability sampling from various college campuses in the Chicagoland area. The survey included demographics and 3 pre-tested metrics, including the rape attitudes and belief scales, masculine role norms inventory revised, and the psychological measure of Islamic religiousness, as well as various questions I adapted from a resource Hart had created, which was focused on myths surrounding sexual assault in Muslim communities. And most of the metrics followed a response scale ranging from 1 to 5, from strongly agree to strongly disagree. And so I won't go into every mean that I found, but I wanted to show the various measures within each set of the questions. So for sexual assault attitudes, the statements centered on blame or victim blaming, tactics used to do harm, justifications that excuse sexual assault, and the sexual assault myths in Muslim communities. So for masculine role norms, these centered on sexuality, dominance, and aggression. And finally, religiosity questions focused on religious beliefs, religious duty, and global religiousness. So just to look a little bit, with all these in mind, let's dig deeper into the sexual assault attitudes and what they're meant to answer the main question, which is, what attitudes do Muslim men on college campuses hold regarding sexual assault? So overall, the composite mean was 4.36 across these measures, which revealed that respondents had a propensity to disagree with the sexual assault attitudes. So statements regarding justifications and tactics revealed a strong tendency for respondents to disagree, such as the statement, if a woman is unsure about whether she wants sex, it's okay for a man to persist until she flatly says no, with 65.9% strongly agreeing. And then statements around blame and Muslim myths presented more variability. So for example, a woman who willingly gets drunk then is raped has more responsibility for what happened than if she decided not to drink, with 10.6% strongly agreeing and 17% slightly agreeing. So additionally, when presented with the statement, if a woman wears hijab and dresses modestly, she will be protected from sexual assault, about 51% of respondents strongly disagreed, 14.9% slightly disagreed, and 8.5 strongly agreed. So based on this variability in the statements centered on victim blaming and myths within Muslim communities, we can infer that some Muslim men may instrumentalize blame and justifications through cultural religious behaviors and fear as a means to undermine the experiences of victims and constructive ways of dismantling the deeper causes of sexual assault. However, the overall disagreement with tactics and more overt justifications for sexual assault reveal that Muslim men may recognize the harm in behaviors that force sex upon women, but may not completely understand the covert forms of perpetuating those behaviors that justify the act of sexual assault. So now moving on to our second research question, we focused more on understanding the impact of masculinity and religiosity on sexual assault attitudes. So we used gamma testing to understand the relationship between these beliefs. So when looking across the various tests between sexual assault beliefs and religiosity, there is not a huge association. However, when looking at tests between the masculine role norms and sexual assault beliefs, many of these revealed very strong, significant relationships. So for example, this sexual assault belief statement, if a woman wears a hijab and dresses modestly, she will be protected from sexual assault. When it was crossed with a statement of masculine dominance, so a man should always be the major economic provider in his family, it revealed a gamma of 0.65, revealing that masculine role norms are much more likely to have a relationship with sexual assault beliefs. So these findings were really corroborated by, I did Spearman's correlations and ordinal logistic regressions as well. So while I conducted many individual tests between only masculinity and sexual assault beliefs and between just religiosity and sexual assault beliefs, the results were similar to the ordinal regression I conducted between all three. So masculine role norms, religiosity, and sexual assault beliefs. So overall, they formed a statistically significant model where masculine role norms and religiosity explained about 31% of variance of sexual assault beliefs. So however, only masculinity was a statistically significant predictor in comparison to religious duty and global religiousness. So what does this all mean? So in terms of masculinity and the variability across these masculine role norms, they reveal an adherence to traditional gender roles and a perpetuation of sexual assault as a form of hegemonic masculinity. So while we can't say to what extent Muslim men perpetuate negative masculine norms, we can acknowledge the deeper manifestation of masculinity and the perception and perpetuation of negative sexual assaults attitudes. And the religiosity measures all exemplified that most of the respondents adhered to Islamic tenets, but were weak in terms of helping us understand how their religious identity impacted their perceptions of sexual assault. So I don't want to undermine the role of religion, but rather signal a need to look further into other facets of religious identity and experiences and how they may uncover how sexual assault attitudes are formed. So overall, the study confirmed that men, regardless of religious identity, are likely to perpetuate hegemonic masculinity within their perceptions of sexual assault. So this both contributed to the existing literature while also giving us an opportunity to delve into more of the cultural norms that perpetuate masculine dominance and sexual violence. So in terms of the limitations, they mostly stem from not engaging Muslim men in prior research, especially with regards to the skills that we were using and the methods and our ability to recruit participants. So the surveys and scales I used were adapted from validated measures, but none were created with Muslims in mind. So it's really hard to determine whether these measures fully capture how Muslim men perceive of sexual assault. And then I also yielded quite a homogeneous sample in terms of high religiosity of the participants and an unrepresentative sample in comparison to the larger Muslim American population, especially an underrepresentation of Black Muslims. But I think the largest limitation is the stigmatized topic of sexual assault and the barriers within our Muslim communities of engaging this larger social issue. So in terms of implications, we must elevate the presence of Muslim men within the larger conversation regarding sexual assault and its perpetuation. And particularly, I want to highlight the Muslim men in the study who decided to engage in the survey, and by extension, having being part of this larger conversation confronting sexual assault. In terms of research, I hope the study allows us, particularly Muslim researchers, to create more nuanced and culturally tailored measurements and tools that capture religious and cultural identity and experiences. And then even more practically, I aim to utilize this research to further build culturally sensitive programming in partnership with Heart to dismantle deeply ingrained attitudes rooted in hegemonic masculinity. And then I just have this last, we can only bring justice to survivors through critical engagement in community-based action that are rooted in destigmatizing and dismantling systems of sexual and gender-based violence perpetuated in our communities. And I thank you once again. I hope this wasn't too bad in terms of the quality, and I hope it, makes sense through all of that. And again, thank you to Muslim Mental Health Conference for giving me the space to present this. And I will also include in the chat box more of my contact information because I realized I didn't include that in the slides. Thank you.
Thank you so much, Yasmeen. And so I think we're all using our little clap emojis. And so let me just now kind of more properly introduce Yasmeen. So Yasmeen's a research coordinator at the Center for Urban Research and Learning at Loyola University Chicago. She recently graduated with her master's in sociology from Loyola University in Chicago. She has experience in conducting various forms of social research, community-based research, and research with Muslim communities specifically, and she strongly believes in collaborative research as a means to defy social injustice as well as a platform for community empowerment. I think we see that here. This was a really beautiful presentation, and I'm really looking forward to discussing that further in the Q&A. I think we'll have time for that. And then,
so thank you for the opportunity. So I hope it will like I did. Okay.
Okay, so thank you so much. So if I can just, again, so as I did for everybody, just more formally read Zehra's bio. She's a Ph.D. candidate in counseling and psychology at the State University of New York at Buffalo, as she mentioned. She's currently a pre-doc psych resident at University of Illinois Urbana-Champaign Counseling Center. Previously, she was working at Roswell Park Cancer Institute as an advanced practical clinician. Her clinical and research interests include diversity, multicultural issues, eating, body image concerns, death and dying, grief and loss, discrimination experiences of marginalized groups. She's also working on her dissertation, which is, as we've learned, is about discrimination experiences of Muslim Americans in the Trump era. So thank you for all of our presenters. And I'm just going to actually start backwards and go backwards through the panel and just have some comments and feedback and questions myself before we open it up. We have almost 50 people that have been listening in and enjoying these wonderful papers, and so I hope we can have a robust discussion, and we've kept pretty good to time, so I think we're going to be able to do that. And so I'll begin with you, Khayr. So I just wanted to say a couple of things. So my own work is on the wide spectrum of American Muslim communities. I'm a historical anthropologist, but I actually did consult on several of the Pew studies, and so of course your research confirms some of the findings of the Pew studies, and you're citing that work. And so one of the things that I would just say is that it's interesting to think about some of the hate crime research, which we have to of course always be a little bit suspicious of because of the issues around reporting, as you rightly brought up. So for example, we know that at least the Pew data shows us that Muslim women, for example, across the board, may experience, when you self-report, experiencing more instances of discrimination than Muslim men on the whole, and yet they are less likely to report. So part of what we see, and then if we look at like a case like New York, we have this huge jump in the reports of anti-Semitic racial violence, which of course is real, but there's no way that there's more cases of anti-Semitic hate crimes than there are against other minority groups happening in New York right now. It's simply about how comfortable Jewish groups feel reporting to the police. So these larger issues about how minority groups or particular subgroups feel in relation to institutions of authority is also a factor that has to always be brought in when we're looking at survey data and interviewing people about their relationships in terms of discrimination and things like self-reporting. And so one of the things that I was really struck by in your study was the huge number of white people who reported to be white in your study, white Muslims. And I wondered if you could just kind of contextualize that finding, because in your theoretical framework slide, you were talking about how you were drawing on that theory and using the slide, which was talking about essentially an ethnicity model, which was North African and Middle Eastern. And of course, that's not equivalent exactly to what Muslim is. And you were trying to kind of make a kind of parallel, which I understood, which is complicated, and I appreciate how nuanced that can be. And so when you were trying to theorize about why it might be that the Muslim respondents to your study might be having a lower number than you might have anticipated in terms of what they were reporting of personal experiences of discrimination, and you said, well, it might be, this idea of religious forgiveness or acculturation. I mean, the first causal explanation that would have come to my mind would be like, well, they're all white, so that might be the number one reason why they're getting a lot less racial experience of racial discrimination as Muslims, is because these are white passing Muslims. And so I wondered if you could address that question. And frankly, I mean, one of the things that I think makes your study quite interesting is that I can't actually think of a study that has such a large subject population of white identified Muslims, that's a quantitative study. So that's a really valuable thing. So I'm just going to go through and then we'll all take all the responses at once. And so then I wanted to turn to Yasmeen's study, which I think also really has the same kind of real originality and potential to be published as well. And I wanted, again, to think about some of the, I mean, it's really compelling, and I wanted, again, to just think about some of the problems that come up when we talk about quantitative data and the questions around measuring religiosity. So two things, you know, I mean, I have to admit that I have my own kind of pet interest and personal stakes in these questions around patriarchy and sexual violence and, you know, kind of longstanding personal kind of activist commitments in these issues. And so, you know, two things that have happened in the kind of context of the war on terror is you've seen this sort of new politicization and gender politics around Muslim women as the kind of warriors of the community, particularly Muslim women who wear hijab, as being the quote unquote front lines of the community, facing the brunt of anti-Muslim racism in similar ways, actually as Sikh men, because they wear turbans. But of course here there's a gender reversal. So they're both the most vulnerable because they're the most visible. But in this case, because they're also, it's a patriarchal logic, and so there's a kind of subversion, and so there's a way in which Muslim women who wear hijab in particular are kind of like the most vulnerable, and yet they're also the most brave, and so they're kind of, you know, there's a kind of really complicated politics there about the publicness of these female bodies that are now vulnerable and therefore also have to be strong, and so I think in that context, you know, the kind of research that you're doing around sexual violence or physical violence and vulnerability becomes that much more interesting. And so, you know, I mean, that just was one thing that like was in the back of my mind, is that, you know, it's not just like these mythologies around rape and are kind of in a vacuum. It's also happening in this kind of larger political context in which particularly the young Muslim hijabi in public is also a very politicized body. And so then my other question was around, you know, you kept referring to like the ways in which global religiousness is a factor or not a factor in the ways in which these, you know, patriarchal values are being correlated here and thought through in terms of sexual violence. So generally speaking, when we look at like studies like Pew, Gallup in general, anyone who works on religious values, there's a kind of understanding that people can self-identify as being religious or religious practicing, but all of that stuff has a big question mark on it. So what we find is that, you know, when we ask people, are you religious? They may say yes, or very religious, or kind of, or sort of, or whatever they say. When you ask people, do you go to church, or do you go to a mosque, or do you recycle, or do you volunteer, or do you vote? They will self-report a much higher participation, whatever you ask them. People think they do things way more often than they actually do them. So when we actually go and count people's seats and showing up, or who shows up to the mosque, the numbers of people like in the South who show up in churches is about the same as it is in San Francisco. So like Louisville and San Francisco is about the same, but people in the Bible Belt will tell you they go to church way more often than people in San Francisco will. And the same thing is true for like a lot of other things. And so that issue of like whenever we talk about religion as a measure is complicated. We talk about religiousness as a measure. So that was just something I wondered if you had thought about, you know, when you're talking about these young Muslim men and their self-identification as religious or not. Like, is this simply a descriptor that they identify with? Does this have anything to do you have any way of capturing or correlating this with any kind of like measure that is something else, because and how much can we trust that? And then finally, Ahmet, to your paper, you know, it's interesting. one of the things that I was struck by, and of course, I think to be honest, the most compelling part of it to me was what you just teased us with the very end, which is the possibility of expanding this research into a place like Turkey, because of course we have plenty of research on college students in the US, and what we really need to know more about is places in the global South, which are so understudied and are so much harder to study, and the idea of being able to capture, particularly in the conditions of the pandemic, by using this methodology, which you're calling Photovoice, but I think we can think of it more expansively as just, like digital, research. And of course, as an anthropologist, digital ethnography is a long-standing method. So my question actually was about, one of the things that I was really struck by when you had the metrics of all the different concerns that the subjects of your study brought up in terms of frustrations they felt of things that were not being addressed for them. I have to say, I was so surprised by just the weighting, like when you were giving examples of like how important it was for them to think about things like, I don't know, sort of ritual matters like wudu or like needing a masala to pray in, compared to politically pressing things, whether it was, I don't know, Syria or Palestine, or even just discrimination in the US. I mean, and in particular, as you said, this is a study about the South, and just in this sort of political moment and the kind of coalescing of all these different political crises, I mean, I just was really struck by that. And since your study really is Muslim Student Association students, I think, I wondered if there wasn't a kind of, I don't know, apolitical sort of self-selection of the students that you were talking to, because I just have to say, I really was surprised, as somebody who has written a book about college-age students and the kinds of things that they talk about or are concerned with. I can't imagine like lotas being really up there, or like water bottle concerns being like at like a top 10 issue. So I mean, frankly, I was just kind of like shocked by like their priority list, and I wondered if you could just tell us a little bit about the weighting of those issues and how that came about, how you sort of did that. So I'll just stop there and let you respond to those questions, and then we'll open it up to the audience immediately after that. So the speakers want to unmute and respond as you like.
So I could go first if no one is volunteering. Okay. I mean, I think this is a really good point about like my participants, like demographics has a really impact on the results. So, and especially like 50% of them are white, and the rest, I mean, I think 38% are actually South Asian. But even though the white actually like community in the Muslim community actually like, unfortunately, census 2020 still actually didn't confirm like EMENA, like American, Middle Eastern, and North African. So they don't sometimes like feel white. They could just pass as white, but like they had, I mean, since like lack of the like other kind of like race, they just like go, check the white box. The race is still actually like a very controversial issue, which I actually thought about if I should include or not, but since it's not approved by United States, so I just decided not to. So majority of those white people probably Arabs, or just like identify themselves as Arabs. But since since I didn't actually give them a choice of like choosing the EMENA, so they just like pass as white. But I think like this is I still like there's a there's a really good point in your in your comment, because yes, they might not experience that much actually like high discrimination because they still pass as white, or like they are not actually like, I'm not including that much like black and or just like multiracial or Latinx Muslim community. But one thing that I came across, like I actually like collected data from, I reach out to like almost 1,000 of like Muslim Americans for actually last couple of years, and like 790 people just like opened my survey, but only like 300 completed. So even 300 of them, actually some of them who actually completed, they reach out to me individually and they ask to remove their results, or they actually like express some concern about just saying, well, I think like I am in the green card process, like I'm actually worried about like answering this question. So what if actually like it was captured by the government, and what if actually it would impact my status here? So especially for the discrimination studies, actually like have I mean, discrimination studies like have really like asking really sensitive questions. Like we are asking them to reveal their actually like political perspective. We are asking them to just like talk, maybe, I mean, even rate their discrimination based on Trump. Even actually it is very like controversial topic. So probably like majority of like my participants are like well educated, because they are more in the research area, and they also like are very vocal and more I mean, they are advocating more. But and also they are privileged in order to say that, because they, if something happens, so they might not lose their job. But in terms of the discrimination that actually, let's say, I mean, less educated people actually like dealing with. So if something happened to them, so they might lose their like right off to like working, and it might be actually, it has a bigger impact in their life. So that's why probably they might not able to just attend. So it is really important. Not only, I think like the rest of my dissertation actually focused on like some research. I mean, what are the like research implications? So what are the things that we could just do more in order to like have their trust, and then it would be like more inclusive, and eventually those research would be like more like generalizable in the like general Muslim American population. But it is not only like this research problem, it is also like general discrimination, especially like Muslim American discrimination research issue, which was actually addressed in the literature before.
Yasmeen?
In response to your question, so thank you for commenting on the research and whatnot. What you bring up about kind of the gender politics around Muslim women, I think is really interesting. And I don't think I really thought about it too much in relation to when I was building this project, but I think it's interesting to think of how Muslim women are seen, they're on the front line, especially ones who wear hijab, and are more vulnerable in that way, and are so much in the public, but at the same time, culturally within our communities, we are often, made to be so private and unable to really, move around within our community in the ways that we want. And so I think that's really intriguing. And now that I'm thinking about it, I think that plays, a huge role in how we're understanding how Muslim women are navigating, both within Muslim communities and outside of it. And really kind of getting back to this idea of like kind of the hegemonic masculinity aspect of like, why are Muslim men so willing, why do they want to assert their power and control over Muslim women, and how does that play out, when Muslim women are so public and are so taking ownership of their lives and have this autonomy, and so that's, I think, I don't know, really intriguing question. And I do want, because this kind of relates to this topic, but someone had put a question in the chat regarding hegemonic masculinity, so I wanted to address it before moving on to the religiosity issue. And he asked, how can we define the limits of hegemonic masculinity? And I think, again, we have to remember that the point of hegemonic masculinity is the power and control over women, and it's the subordination of women that can be done by both men and women. It's internalizing this idea that women are less than, have less value, have less power. And so because of that,
Folks like Yasmeen has frozen momentarily.
Should we let Ahmed,
sorry about that.
yeah, should we let Ahmed go and come back to Yasmeen?
Yeah, why not?
Yes, yeah, we'll give Yasmeen another opportunity. Yes.
Yeah, so your question was that we did not come across any discrimination themes or as much as that you were expecting, and also not coming across themes at the global issues like talking to the institutions or the governments. Am I correct, Dr. Grewal?
Well, I'm just saying it was much less political than I would have expected. It was very it was very much about religion in a very ritualistic way.
Yeah. Well, first, our main partners were MSAs and Muslim communities, Muslim mosques, because we did not have just Muslim students. We had Muslims and college-affiliated Muslims. So, yeah, and we asked in our research question, we asked them to think their campus experience as a Muslim. But when you look at when we look at all the themes of the concerns, you really can see they are constantly saying that they have been discriminated, and this discrimination is not just at the micro level or at the meso level or at the exo level, it is at the macro level. Because like they are saying, if you read their stories, we had 3 hours community a whole meeting, and we had the media, we had the police, we had the mayors, we had the chancellor, and they were saying like, why we are holding meetings about Islam, why we are doing this, institutions should do this. Right. And actually that was really effective that after these 2 research back to back, we really got some really good financial help from the university. Like they increased the MSA budget by 100%. So in the between lines, you can see all that discrimination, and they were pointing to the institutional levels. But very openly, they were talking about the global issues, about 10% talking about Palestine, Syria, Zionism, and US attacking their lands. But all other between lines, if you read the stories, they were saying, okay, these Americans or some of our friends do discrimination, but the main reason is the media. The main reason is constantly politicians are talking about this. But if we were putting such a team, almost all the teams would have gone to that. And we wanted to give the voice to the partners as well. So they were shaping the teams, the main.
Yeah, great. So I think Yasmeen came back, and we know she got cut off. If that's okay, Ahmed, if you can let her finish her point. Yep.
Yeah, so I think almost all of these were about discrimination and pointing to the institutions. We just wanted to make sure that we, and in OIPA, we are using OIPA. So in OIPA, you really go with their team rather than reading their stories, rather than trying to make meaning. You are using their teams. So in their teams, they were not using government, but between lines, they were constantly using the team. So
interesting. Great. Thanks so much. Okay, Yasmeen, did you want to finish your comment?
Yeah, I'll finish. Sorry about that. My laptop was heated. I wanted to keep talking a little bit about the issue of hegemonic masculinity and kind of going on about that a little bit in terms of really understanding how, this idea of power and control, as I mentioned again. So really anything that is subordinating women, and that can be both men and women, and because this issue of hegemonic masculinity is so normalized, it's internalized by everyone, participating in it. So it's really hard to really kind of break out of that mentality and recognize like, oh, like these are, you know, fake limits that we've put on individuals based on, you know, socially constructed identities. So you know, understanding that this is about power and control and really kind of moving away from that, that's kind of where the hegemonic aspect of masculinity comes in. And so the follow-up question that this individual asked was, you know, does popular masculinity include traditional values, you know, that are part of Islam? And I don't have the question fully formed, but I think understanding that hegemonic masculinity is separate from just masculinity. You know, like this is not to dock men and masculinity, but rather, you know, recognize that, yeah, there is divine masculinity that is within our tradition, and recognizing that those are, you know, characteristics that should be filled with compassion and humility, and that is not, you know, coherent with power and control and subordination of women. So rather than, you know, pigeonholing what masculinity can be, rather looking at like, how can we raise men and like include men and boys in our communities, and understanding how you can be a man and embrace masculinity in really positive ways that include women, and, you know, that divine masculinity, these traits that are attached to this, you know, it doesn't have to be just for men. It's, you know, very, you know, holistic characteristics that can be universally embodied. So really, you know, getting out of that narrow framework of what it means to be a Muslim man, yeah, you can be protective of women, and you can, you know, embody, you know, ways of, you know, including women in your day-to-day without it being controlling, you know, and really pushing that and normalizing that. And that's really, it's really hard to do that, but that's kind of the impetus for a lot of this research. Should I continue to talk about the religiosity?
Sure, if you want to say something about that quickly, sure.
Yeah. So this is, I'm constantly thinking about this. And I really was thinking about it in the research when I was making the study, but every time I, you know, look into measures that in like surveys and metrics that have been pre-tested that are focused on religiosity, they always seem so narrow to me, very like superficial in terms of like, you know, yeah, it is like, do you pray 5 times a day? Do you go to the mosque? Like how often? And so what I found, and I think I kind of talked about it in the limitations, but, and it also had to do with, you know, my sampling. It ended up being more people from MSAs that tend to be highly religious, or name themselves as highly religious. It really doesn't get to the nuance of like, okay, what does it mean, you know, in the day-to-day experience of being Muslim, and how do you embody that, and how do you measure that in a survey? And so, I mean, I don't have an answer for that, but I think this is something that I think should be a bit more explored with, and especially Muslim researchers, to create these kind of metrics, because we are losing a lot. And it really doesn't, these measures don't capture the complexities that come with being Muslim. And, you know, for the study specifically, I think they didn't, you know, the measures didn't, you know, show a lot, I think, because we're talking about like cultures, religious culture that is perpetuating hegemonic masculinity, or these, you know, problematic issues that have become intertwined with religion and culture, that's really hard to pull those out into specific questions that then can be measured in a metric or a survey. So I think that's where it becomes really complicated, and where, you know, if I did another study, I definitely want to do more qualitative, which is what I'm more used to and prefer, because you really can't pull out the religion just from asking if they think they are, you know, how religious they are with one. So I definitely like that is a next step in what this research hopefully showed, is that like we still need better scalings and metrics for how to capture this.
So may I add like one comment about like, because if it's okay, like in terms of,
Sure.
Yeah,
like scale. So I think like I use like religiosity and religious commitment like in my dissertation too. So I've actually come across with the same problem as you, Yasmeen.
Yeah.
So I think it is like very behavioral questions, like all those scales ask. But I think like those religiosity we are trying to just like measure, it's more like I came across like religious commitment more than religiosity. And most of the time also like in my in my culture, so if you ask people like are you religious, so it is like little hard to just say yes I am. So like because of the like you have to be humble, like only God can know like if you are religious or not. So there are so much dilemma. So I think I actually ended up just like using the term religious commitment, and there are actually some different scales in terms of religious commitment in Muslim Americans. It is still actually like it has like so many weaknesses as well. But not only just like asking behavioral aspect of the religion, but also asking the identity. So how much important for you to be Muslim or just like feel Muslim in this environment or in that environment, maybe like that might be actually more, that might capture more the things that we are trying to measure, because like most of the time we are actually using religiosity as a coping mechanism or as a discrimination actually like thing, or but those behavioral aspect is not really capturing the construct that we would like to measure.
I unfortunately, I think we're out of time. I hope that, you know, we still have about 36 people here, even though we're like about 10 minutes over our time for the panel. And I think that shows how much people appreciated these wonderful papers, and I certainly did. And so, you know, we could all just clap or use our little emojis to let our panelists know how much we appreciated their time and their, you know, effort in sharing their research. It was really wonderful. And I think people are asking for the panelists to please share their email. I think Yasmeen has already done that once again, but I do hope that if people have questions, they will either use the Huba app or will, you know, reach out directly to the panelists, because I know that the program is probably going on and there's already probably something next that's on the roster for people to get to. But I wanted to just say, again, to apologize for the rough start that we had. We started a little bit late, and for my own kind of fumbling with the bios and whatnot, and that delayed us a little bit. I apologize, but I really appreciated this, and I wish all of you the best of luck, and we hope to see these papers in a published format so that they can have the audience they deserve. This was really fantastic. So Jazakallah Khayr, and thank you so much, and we look forward to reading this and being able to share it with wider public. So inshallah bitawfiq. Okay, thank you so much.